once they arrive into the entry of the vaccination center, we actually have a lady monitoring their temperatures. This lady basically offers a new clean mask, because we don't want to have contaminated mask coming into the center. So once they get a new clean mask and they get a bit of a hand gel wrap to their hands, we take them over to the administration where the patient is arrived. We gave them information leaflets, and so we ask them to sit them in the waiting area. It gives them a bit of time for them to read through the patient information leaflet. And then we've got ushers that will actually, which is actually helping us to get through the flow of the floor. So we don't want to have too many people either waiting in the waiting room or accumulating in the corridors. So they get to go into the clinics. We have 14 vaccinators. So everybody is sort of very swiftly going through the whole 14 different clinic sections. So they get into the clinics. They have a one-to-one with the health professionals. We go through some consultation, but we do ask them a few questions about whether they have any symptoms of fever, whether they have had any anaphylaxis in the past requiring hospital admission, and also basically if there are pregnant women, if they're pregnant, or whether they're breastfeeding. So there's a lot of history to take, and we also ask them if they've had any COVID, positive COVID in the last 28 days. If that is the case, we will not proceed with the vaccination.
And what if somebody comes in for the vaccine and is asymptomatic with COVID-19 and has it, obviously unaware that they do have the virus at the moment? What would happen then?
Basically, we would not know. So basically, it's a risk. The patient would have the vaccine, and we just hope for the best.
Is there any harm in having the vaccine and also having the virus at the same time?
I don't have the answer to that. But it could be the case that a patient could come in, could be harboring the virus, but we would be totally unaware of this. So that's a risk everybody has to take.
So whilst patients are waiting for 15 minutes in case there's any adverse reaction, have you had many instances of adverse reactions?
We've just had a very minor, just very few things like patients complaining of arm pain, or maybe something like, funny feeling in the tongue, but no adverse reactions to date.
Excellent. And how about the vaccine itself? If people don't show up for their appointments, it might not get used. So have you had many vaccines wasted or anything like that?
We are counting every drop that we give out to the patients in the community. We do not waste any vaccines. And if we do have any last-minute cancellations, we always have staff on the floor that still haven't had the vaccine. So we give it to our frontline staff.
And finally, a message you might like to share with our viewers, anyone who might be getting the vaccine soon or perhaps is a bit nervous about it all?
Not at all. Actually, I'm seeing a very positive response from everyone. We've seen quite a very good response from the frontline staff. And over the last 2 days, I am seeing very positive results with elderly patients coming through, whereas before they were declining appointments. I am now receiving demand. I'm constantly being phoned, called on to put them in because they now want the vaccine. People were a little bit apprehensive, especially the elderly population. A little bit nervous, there was a little bit of fear. I mean, yesterday I had a patient which took me around half an hour to try and sort of, convince her, reassure her. In the end, she had the vaccine and she went home really happy.